So we're here again today with Jim Reed, a longtime patient of ours who has volunteered to be a guinea pig for us long term as well, trying out the newest and best technology from all the different hearing aid manufacturers. So the first products he tried out were the Phonak Marvel behind the ear instruments. So this time around we went ahead and went with in the ear instruments with hearing aids from Widex, and this is the Widex Evoke 440. So we're going to be interviewing Jim on the pluses and minuses that he's found with it, and so he and I have talked a little bit before this interview about pluses and minuses can vary from person to person as to all about their preferences, but he brings up a lot of good valid points that maybe the manufacturers at Widex or the other manufacturers might want to pay attention to in order to develop products and features that will meet everyone's specific needs as they come up. So for Jim, let's talk first about the main thing. The whole reason why people get hearing aids in the first place is to hear better. So with the Widex instruments, how well has the hearing aid been going? You hear everything pretty well?
It's great. It lives up to its expectations. It has good clarity, good volume, nice and clear, and they're real good hearing aids.
Okay, so when it comes to volume, how often, they do have the ability for you to adjust the volume, which we'll talk about later, but how often have you felt the need to adjust the volume to turn it up or turn it down?
Very little on the volume. It's the different apps that it has that I use quite a bit.
Okay, so how the hearing aid automatically adjusts volume has worked actually pretty well?
Yes, it does.
You haven't seen too much need to adjust it? Me personally, as a provider, I like to give people access to it just in case they need it. So hopefully they don't have to use it, but it's good to have it there just in case something comes up. I tell people it's kind of like a spare tire. Hopefully you don't have to use it, but you're glad it's there when you need it. So now the hearing aid also has automatic features to deal with noisy situations, difficult listening environments. How well has that worked for you?
It's worked great. It's nice and comfortable. The hearing's great. And, well, about the only time I've adjusted the volume is if I'm in a real noisy restaurant. Other than that, it does very good on its own.
Okay, now you're talking about adjusting the volume in a restaurant. The hearing aid does have features for you to activate, like the directional microphone features to reduce the effects of background noise. Did you do that at all?
Yes, I have used the focus, like I say, especially in restaurants where it's real noisy. I'll focus straight ahead of me instead of, so I don't get a lot of noise from the back.
Okay, so again, continuing on with primary features in the hearing aid, how's the battery life? So it's one thing that Widex touts is they have a really good battery life. How has that worked for you?
Well, the battery lasts good week and a half.
Okay, that's about right to me. These are a size 312 battery for his hearing aids. He's wearing full shell in the ear instruments, but because of the circuit and his ear, he needs a bit of power, and so it's a 312 battery, which normally the battery life is about 7 to 10 days, which is about what he's getting. Right. Okay, so let's talk about kind of the secondary features of the hearing aids. So, so these have Bluetooth capability where you can link them to your cell phone, and so you can take incoming calls and listen to it through your hearing aids. I don't think you do this too much, but you can tell me if I'm wrong, but it also has it where you can listen to music or other things that are downloaded to your phone, like your hearing aids or headphones for that type of stuff. I don't think you do that quite as much. For phone calls, let's just focus on the phone call aspect. How is the clarity on phone calls? Is it pretty good?
The clarity is exceptional on phone calls.
Okay, I know you have some reservations about how the entire system works, but just looking at the primary aspect of it, so phone calls are good. So tell us about some of the things that you didn't like about the system.
Well, what I really don't like is this neck loop thing. I can answer the call, answer the call and hang up, but other than that, it's useless.
Okay, so it does its job for the phone calls, but it doesn't have, well, you're also used to other things too. So your previous set of hearing aids that you got that are yours and stuff, not anything that you're just trying out, were a pair of Phonak B70 in-the-ear hearing aids. And so with those, you had a device called a Compilot, which was also neck loop, but it wasn't just for Bluetooth. It actually had remote control capability, so you can actually adjust the settings in it. And that's what you're kind of talking about missing, that you said it's useless, but it's just not as doesn't have as much utility as the Compilot did. Does that make more sense?
Right.
Okay. And so Widex tries to overcome that with an app, okay? And while the app is cool, you found a downside to that. So.
Well, the app is great, especially with my original ones. With these here, I have to use my telephone to make any adjustments, which in my case, I wear gloves a lot. And it means taking the gloves off, making the adjustment, and then putting my gloves back on so I can continue with the work I'm doing.
Yeah, because you're like clearing land and stuff like that, so you've got the gloves off for doing things. So it's kind of a hassle on and off with those, whereas you found like with the Compilot, you could just push a button on the device to make changes, right?
Right.
Yeah.
And the button on my Compilot is big enough I don't have to take my gloves off. I can just reach up and tap it.
Yeah.
Whereas with these hearing aids, the ones I tried before this, I have to take my gloves off in order to make the adjustment.
Right, because on the device he's wearing around his neck is called a Comdex. That's the Bluetooth interface that it has with the cell phone. It has this nice little silver button here to answer or hang up on phone calls, but it's much smaller. So it's kind of a trade-off because the manufacturers, the Phonak Compilot is a larger device. Well, they were trying to get away with making it smaller because people don't like this big thing hanging around their neck. You prefer to have it because it's nice, because the controls are easier to manipulate, right?
Right.
Okay.
I prefer to have it around the neck. I don't want to have to touch my ears.
Right.
The only time I want to touch my ears is putting them in, taking them out, or changing batteries. Other than that, I don't really want to have to touch my ear.
Right. So, okay, so there's something to be said for still having accessories. And for some people, they're going to want to move past accessories and not have them. For some people, they do want to have them. So, other pluses or minuses that you found specifically about these hearing aids as compared to other things that you've tried?
Well, they really don't have any more pluses than what mine do. There's a lot of things that I miss that they don't have. They don't have caller ID, voice dial. They do have a Bluetooth now, or they have a TV link. Now the TV link is line of sight.
So you found that when you got past a certain way, you lost signal?
Or if I walk in my computer room, there's a wall between us, I lose it.
Okay.
It does not go through the walls.
Okay.
However, mine does.
Right. So when you say yours, you're again referring back to your Phonak TV Link device.
Right.
So whereas the Widex TV Dex, the range was not near as good.
No, it does not have quite as much range, and it does not go through the walls. Like I say, it has to be line of sight.
Okay. How is the sound quality of it, though?
Sound quality is excellent.
Okay, so that was pretty good too. Yeah. So the trick is you just don't have as much range at all.
Right.
So, okay, so again, some pluses and minuses there. So anything else on your list to address?
Well, if they would have caller ID and voice dial, they would be the equivalent of what I have.
Yep. So for those of you who are going to be following our little series here that we're doing, which is going to take us a while to get through it. By the time we get through every major manufacturer's hearing aid, will probably be time to start up again with the first company when they come out with something new, because we've got a ways to go. That you're probably going to hear a recurring theme from Jim is that's a feature that he likes to have, is the caller ID feature, which honestly I feel that the manufacturer, that should be a software change. They should be able to work it out where it could still send a signal to your hearing aids giving you the caller ID. Voice dial, that could be trickier because you got like one little button. How do you make it work to do so many different things? So so that would be trickier to pull off, but we will see. So. All right, did you have anything else to add before we end?
No, everything's great.
Okay, so where we're moving next is just kind of give you a little preview. Is Jim has mentioned to me that he's been trying out the in the ear, and part of the reason for that is one of his ears has been altered such that behind the ear hearing aids are difficult to wear on that side. So he has indicated to me he'd kind of like to go back that direction and try it anyhow. So some of the reason has to do with moisture buildups and things along those lines that he finds that the in-the-ear hearing aids are more susceptible to. We're looking at some solutions for him to deal with that. At the same time, though, we'll probably go ahead and some of the forthcoming hearing aids that we have him try out will be in the behind-the-ear style. The next set, however, we are going to stick with in-the-ear. We're going to be showcasing the Oticon Open 1 custom in-the-ear hearing aid. And so for him to try out and evaluate. Oticon actually has a new product out called the Open S, but they don't have it in an in-the-ear format yet. So, but we're going to go with the Open 1 in-the-ear product now and see what he thinks. Down the road, we may try the Open S or something different depending on how long it takes us to get through all these different manufacturers. So, unless there's anything else to be said, I'll let Jim sign off for us.
Well, everything is working great, and I'm going to make your day. I'm going to leave.
Okay. All right, thank you.